So my name is Jen, and I'm the Marketing and Communications Manager for Arrow, the Bone Marrow Transplant Foundation. And I'm coming to you tonight from Darramuragal land, up on the north side of Sydney. We have joining us tonight Yvonne Panek-Hudson, who is Clinical Nurse Practitioner. She's at Peter Mac Cancer Centre and also the Royal Melbourne Hospital. We have Pippa Labuc joining us. Pippa, I don't know whether I got your name right, I hope so. And Pippa, you're also at Peter Mac, I believe. And we have Jacinta Lewin joining us as well. Jacinta is a lawyer. She's a principal lawyer with Maurice Blackburn. And I believe all three of you are from Naarm, Melbourne, on the lands of the Kulin Nation. All righty. So tonight's webinar, I'm going to hand over in a minute to Yvonne to host the webinar for us and lead our conversation. Before we start though, I would really like to thank Tour de Cure, who have helped make this webinar series possible. And just a reminder that we'll be talking generally about the bone marrow transplant journey. So we can't actually provide any specific advice for you tonight, even though the women who are joining us are extremely expert in their fields. If you've got anything that is particular to you that you really need help on, we encourage you to approach your transplant team. Yvonne, with that, I'm going to hand it over to you if you would like to unmute, and I'm just going to say bye for a moment. Oh, before I go, questions. We're going to have time for Q&A at the end. Please put your questions into the Q&A tab. That's where we'll be looking. The chat is open and you can certainly interact with one another there, but I'll be focusing mainly on the Q&A tab, which you should be able to access down the bottom of your screen for questions. So we'll gather all of those up and we'll answer them at the end. Thanks, Yvonne, over to you.
Thanks, Jen, and thanks to Arrow for running Transplant Talk and giving us all the opportunity to share our experience and to bring the wonderful transplant community together. And thanks, Jen, for suggesting that people put their own personal details in the chat. It's so interesting to see where people are from, you know, all around Australia and at different stages post-transplant, but also to have carers join the webinar tonight. So without further ado, I'd like to welcome everyone here tonight to a wonderful presentation that's going to be provided by two really wonderful and very experienced speakers, Jacinta and Pippa. I'm going to have a bit of a conversation with Jacinta first, and really what I'd like to do is tell you a bit about Jacinta, who I have the privilege of knowing really well. So Jacinta Lewin is a principal lawyer for Maurice Blackburn, and she's in the social justice practice. She works in complex litigation, assisting the community to access their legal rights. Jacinta enjoys working with people both within and outside the legal profession to improve access to justice and address systemic issues that pose challenges for everyday people. In 2022, Jacinta received the Law Institute of Victoria President's Award for Outstanding Service to the Legal Profession. Congratulations, Jacinta. Jacinta and I met way back in 2012, 2013. Jacinta underwent a stem cell transplant in 2013, and she's going to tell you all about that. Jacinta values increasing awareness of the support services available for patients, carers, and healthcare professionals navigating bone marrow and stem cell transplant process. So, Jacinta, welcome.
Thank you.
The other thing, just a little bit of extra for everyone. Jacinta is actually one of our guests on the Straight and Marrow podcast, and we will be launching that podcast conversation we had with Jacinta, which will be our final episode for season 2 of the Straight and Marrow, and we were really pleased to spend that time with you, Jacinta. and record your story. So without further ado, I'm going to hand it over to you to begin by telling us a bit about you, about Jacinta, everyday life, and about your transplant story. Thanks, Jacinta.
Thank you for that very generous introduction, Yvonne. I'll be more conscious of making a shorter bio next time I do one of these. First of all, it's lovely to meet everyone through the ether. I know that it can be a really a time of highs and lows where sometimes you're very close to the joys of life, but also the challenges when you're navigating a transplant or caring for someone with a transplant. I was diagnosed at the age of 24 with something called myelofibrosis, which was pretty unusual for 24-year-olds. And then I lived with a chronic illness effectively for a number of years before it became time to have a transplant. And I was very, very fortunate to find a donor, given some surprisingly unusual genetic heritage. So my grandmother didn't tell us the full story, so you might learn things you never knew. I had a transplant in 2013. I was working full-time as a lawyer, but I had already taken my employer on a bit of a journey before I actually underwent the procedure, because I needed some reasonable adjustments to my activities at work, just to make sure I could manage some of the physicalities as my fatigue kicked in. So I started working a 9-day fortnight, which for me was a revelation, and I still work one today, and I think I'm going to consider a 4-day work week if I ever can. So but then I had my transplant. I was very fortunate in that, notwithstanding the challenges of the transplant journey, I was able to start returning to work reasonably soon. I think it was around the 6-month mark, but I did it very gradually, and I had a lot of encouragement from Yvonne and the team, because I did have a lot of hesitation around what that might look like. And I was honestly probably pretty sick still, but also bored out of my brain at home. So I was fortunate enough to find an employer that was happy to work with me on that. And I definitely evolved in my approach to returning to work, which I'm happy to elaborate on, Yvonne.
Yeah, absolutely. I mean, I think that, it can be quite difficult because, as we've talked about before, sometimes you feel ready cognitively, but your body doesn't feel quite ready to return back to any sort of physical activity, let alone work. And sometimes it's the opposite, you feel like you're ready to go, but you're concerned about being, cognitively switched on and ready to deal with the social interactions at work or the challenges of complex, decision making. So is there anything you want to talk about in relation to that?
Yeah, I probably had a slight difference between my perception of how cognitively astute I was and the practical reality. I guess there's some really interesting learnings for me, which is take your employer on the journey with you. And if you do have a supportive employer, it's probably worth starting a little bit smaller than you think you can. And I think I actually went back for a very minor amount, which was about 1 day a week for the first month before increasing. And that was really helpful because I realized that cognitively I was not quite there. And I had to really be a little bit humbled because I thought I was churning out these perfect emails. And then I had a peer who was very, very supportive peer who'd been covering my role while I was on leave, had to sort of really correct my writing for a good 2 or 3 weeks. And I really had to push through a little bit of the cognitive haze that I had, which I think was a really understandable impact post-transplant. But it was also really comforting because it does come back. So if anyone's sitting here feeling a little bit of a sense of concern about going back into these spaces, sometimes it's not until we try that in a gradual and supported way that we start to get those neurosynapses working again. And I promise it's all come back. I've run plenty of cases since then, and so far all's good. So that's definitely a learning. And I think the other major tip that I was thinking about was whatever you think you can do, I sort of think a good starting point is start at about 80% of what you think you can do, because it's always easy to go back and then surprise your employer with how amazing you are, but you've managed expectations firmly from the start about what you can and can't do. So I'd actually told my employer I could be off for at least a year, maybe more. And, you know, then I said, he was knocking on the door at 6 months being like, hi, I'd really like to get back. The other thing you touched on, Yvonne, is the sort of, it is, for me, it was quite daunting going back into the same workplace. Weirdly enough, before I left, I looked quite healthy, even though I had blood cancer. And then coming back, I obviously didn't have hair. I looked quite different. I'd lost a lot of weight. And that was the first time my transplant became visible, which was also an interesting transition. My clients loved it. They thought I was this real, like, hefty lawyer with like a short spiky haircut that was just, you know, a brawler. But for me, it was like a big adjustment to losing some of that femininity and some of those other parts of my identity. And that took a little bit of time to get used to as well. But that's when, you know, good friends and colleagues in the workplace are worth having a laugh with as well, because you do need to develop a bit of a sense of humour sometimes about all of this.
So I really like your what you touched on there around setting expectations, and obviously you set the expectations that presumably you thought were kind of fairly realistic, the 1 year mark, and then you went back a little bit earlier. So would you suggest talking to your employer early? And, you know, how much information do people have to give their employer? So that's, you know, that's a question that's loaded with a bit of personal advice and possibly some legal advice in there as well.
Yeah, so obviously I can't give legal advice, but I can give you an example of what I did and what worked and what didn't work. So pre-transplant, I think it was probably because I was a somewhat naive 24-year-old. I sort of wrote a letter of demand to my employer, not really communicating much about my situation, demanding a 9-day fortnight. That worked, but I wouldn't recommend it. I think that the better way to go about this is really sit back and ask yourself, you know, what is your work environment? What's your relationship like with your managers? Do you feel like there's sort of enough trust there that you can be reasonably open about that journey? You're not obliged to give them a lot of information, and it's really important to understand that. You don't have to make a disclosure, but at times they do have various rights, particularly if you can't perform the inherent requirements of a job, to raise that and maybe get you medically assessed. But generally speaking, I was reasonably open at a high level with my manager after I demanded my 9-day fortnight, of course, because I'd matured a bit in both those relationships and my style. And it was really nice to just have a discussion about what would actually be involved. And I had to send them a little bit of information about what a stem cell transplant was. And, you know, my manager at the time, Steve, was brilliant, and I was sort of taken aback by how brilliant, really, to the point where he was sort of promoting bone marrow transplant parties. I also threw a party when I got diagnosed. Everyone deals differently, but you know, it's amazing that when you do ask and when you are honest and do choose to show some vulnerability with the right people, and we give that trust carefully and consciously, because it is a workplace, so, you know, they have certain structures and needs as well, but I was pleasantly surprised with the amount of support that I got, and I'm quite humbled by it, really. But I would ask yourself, what environment am I working in? Who are my managers? What is it like? Can I take them on the journey early so that we have a plan together and collectively about what things look like? And that can be important later on. That idea of sort of defining what it is you do, depending on your work, can be very different. And that's something that you should always think about to protect your interests as well, which is think to yourself, what am I required to do in my daily job? Do I just want to send myself an email of the notes, even if I'm in manual labor or different work? You know, what does my job involve? Okay, well, bending, lifting, twisting, 8 hours a day. Just if you're still in work at the time you're listening to this, it's a good idea just to write down what you are doing. because then you have a baseline that about what you might want to get back to, but you also have a record of what you were doing at the time. So I would recommend that, particularly if you're in some of these jobs that have sort of more fuzzy definitions around what it is you do day to day. So mine was quite straightforward. I needed to be in office. I needed to be able to, you know, type and write letters. But I think for other roles, there can be other requirements that you might want to think through.
I also really liked what you suggested a little earlier about having someone at work that kind of was almost like a support person or an advocate, a bit of a cheerleader, I suppose. Did that kind of happen organically, or was that someone who was kind of assigned to you? Because I think that's I really like that idea of having someone who you can trust, and perhaps you know, who can support you in terms of your day-to-day work. To have
yeah. Look, I think for me it was quite organic, but I suppose the people that I got the most support from came into two categories. There was obviously the workplace, and I was very clear on, you know, these are my managers, this is HR, and they were very, very supportive. But I think you often get the most out of just having a colleague or a co-worker that can really just be a safe space for you to say, look, this is where I'm at, I'm struggling with this, can you help me kind of navigate this space over the next few weeks? And depending on your employer, you might say, can I have a buddy appointed just to help me with this transition? But I think seeking out those networks is really important. The other thing is, you know, you don't always have to be the person advocating. Sometimes it's nice to have someone else to help you with those discussions if you need them. And also there's always an element of protection. So some people also bring in unions for these discussions, but there's a whole range of conversations. And for me, the most meaningful conversations were when I had co-workers that just helped me with some of my post-transplant needs and quietly corrected all the typos in my letters and sent them back. And it was just a really graceful thing to do that was very kind.
One thing we touched on in the podcast as well is that, you know, you had to negotiate flexible workplace arrangements pre the COVID era. You know, now we're much more familiar with negotiating flexible workplace agreements with the people that we work with and for. Have you got any suggestions, both from your own experience, but also, you know, in today's times?
Yeah, look, I think it's important to know that you can ask for reasonable adjustments, and then the employer sort of needs to consider those. But in terms of actually how you ask it, try and agree on a plan together. Talk to your doctors first. You want to make sure you have a proper understanding of what you can and can't do, and have really thought about that. And someone like Pippa might be available to talk through that with you. But then come up with a plan together if you can, and say, look, here's my suggested plan that my doctor and I have worked on. What do you think? You know, is there anything, you know, I think this is meeting the business needs. Is there anything else we need to talk through? But if at any stage you feel like you're not in a safe space, or the conversation feels unbalanced, don't be afraid to seek legal advice or talk to your union or talk to your, I think it's a health justice partnership or at a lot of the hospitals. It's often better to just get an advocate involved quite early if you're feeling like there's any friction in that discussion. But for many, many people, it'll be quite smooth sailing.
So it sounds like, you know, obviously there will be some differences, but that early conversation and honesty is the way to move forward and actually create a positive working environment when people decide to return to work.
Yeah, I think I've got to be careful. I'm taking off my lawyer hat and putting
Yes.
on my transplant recipient hat, and I think that ultimately we get a lot out of being honest about our vulnerabilities and our needs and what people are going through. when you're post-transplant and returning to work, a lot of people don't have a point of reference for that. So you do need to take people on the journey a little bit so they can understand just how disruptive this process is to your identity, your body, your partner's lives. And I think more times than not, you will find that people are receptive to that. But again, also step back and look at that environment, and you'll have a sense of how receptive or not your workplace would be. But for me, being reasonably transparent was really important.
Yeah, and look, as you said before, I would highly recommend people speak to their medical team, to their hematologist, their transplant physician, but also the specialist nurses that are involved and are part of their team, because firstly, you know, we've often supported people before and given, you know, seen, you know, certain circumstances, different scenarios play out, and so can give people advice. We can also provide letters of support, and we can also refer people to wonderful people like Pippa, who's going to speak next.
So that sounds fantastic, Yvonne, because that sort of wraparound support is really what you need. And I think that's a really healthy reminder that you don't have to know all the answers. You just need to know to ask the question, and that's the starting point.
So just before we finish up and bring Pippa into the conversation and then open the forum up for some more questions, do you have any other suggestions? I've got a couple of things. Firstly, around, you know, overcoming barriers. Are there any tips you have around overcoming barriers? And then also any resources that people can tap into?
Yeah, look, I think Pippa actually touches on it. I found this great book on pacing, and you know, that's where this sort of concept of this starting small and build your steps incrementally. And I like to think, well, whatever I think I can do, I'm going to start at about 80% of that level. The other thing which I think is surprising, but makes me feel optimistic about this for everybody on this chat, is that sometimes you do have to go through, I would call it almost a growth spurt. Like, you know, things will feel a bit tough. Sometimes, you know, my brain felt sticky. And just because it was sticky one day didn't mean it was sticky the next. And, you know, after just sort of gradually chipping away, it's okay to sort of have to feel like you need to push through some of that, because it really does come back. And I think if I'd had a bit more understanding of that process, or at least been able to have a podcast like this or a talk like this where we can share those experiences, it would have been really helpful, because you do feel really isolated sometimes when you're navigating these spaces. And I think the reality is there's great communities out there like Arrow and your nurses that can really be a wonderful kind of North Star to normalizing some of that. You will feel different. You're a different person. You've been through an incredibly challenging experience, but you're also probably a lot wiser and a bit more amazing. So if anything, you're far more valuable to your employer than you ever were before.
That is an absolutely wonderful place to end, and speaks volumes about the experience that people go through, and not only the challenges they experience, but also that whole area around resilience and building strength. So thank you. Just around the resources, Jacinta, I know we're going to provide us with a fact sheet with some resources, which Jen's going to circulate following the webinar. But are there any kind of, is there a top one that you would go?
Yeah, look, Fair Work Australia has some really good, just general know your rights. So that's fairwork.gov.au. And the other one is a little bit kind of transplant adjacent, which is WorkSafe Victoria has a lot of documents on returning to work. Where you'll find a lot of commonality is you may not have been injured at work, but a lot of your employers will know how to negotiate and manage a return to work program, because that's what happens if someone's injured in the course of their employment or in another environment. So they're really good starting guidelines that are written in plain English, that are very accessible. And if you are interested, I'd recommend those two resources as a starting point.
Great, thanks, Jacinta. And look, please don't worry if you didn't get those down. We are going to circulate the resources, but thanks very much, Jacinta. And what we're going to do now is we're going to hand over to Pip. Whilst Pip is getting her presentation up, because she's very clever and is going to screen share, I'm going to introduce her. So Pip is an occupational therapist at the Peter MacCallum Cancer Centre in Melbourne, and I'm very lucky to work with Pip. And Pip has worked with people with cancer for the past 11 years, both here in Australia and in the United Kingdom. Recently, Pip has worked as an education and vocation consultant within the Victorian Adolescent and Young Adult Cancer Service, assisting individuals to remain involved in or return to work or study. Pippa is passionate about supporting people to return to meaningful occupations through goal setting, cancer rehabilitation, which I love, and non-pharmacological symptom management, and has presented at multiple national and international conferences on this topic. It's an absolute pleasure to have Pip here tonight with us on Transplant Talk. Welcome, Pip, and really looking forward to hearing your presentation and then having a conversation afterwards.
Brilliant. Thank you, first of all, so much for having me. And yeah, sorry for the large introduction about myself. I am really excited to be here because this is a subject that I really don't think we necessarily address enough, and it's a huge subject. You know, how do we help people to get back into doing those things that make them them? And particularly work and study is such a huge aspect of all of our lives. So I'm very passionate. I am also very aware there's going to be a lot to cover. So this is what I'm aiming to cover today, is going to be looking at, first of all, a little bit around the stats, because I know stats can not be the most exciting, but actually I think it can be really nice to know, where do you sit amongst the greater population, and actually what is normal for people recovering from a bone marrow transplant. I'm going to look at some of the really common issues that can be impacting on people's work and education goals post-transplant, and then give you hopefully some really helpful tips and tricks about just how can you commence some of those preparing to return to or start. And then also give you some resources, which obviously we will circulate as well after the presentation as well for you all. So just thinking about the stats around why actually is it so important that we're discussing this. And we do know that, you know, a bone marrow transplant is not a small procedure. It's huge, and the recovery and the impact of it is quite significant. And we know for a lot of people this does mean that either they need to pause or, you know, put on hiatus their work or their studies. And actually the rates of people re-engaging, particularly around work, is really significant post the transplant. So we know that 1 year post-transplant, only about 36% of people are return to working. At 3 years, this is up to 51%, and by 5 years, it's up to 60%. So it does grow. But I think this also, hopefully, looking at these stats, lets you go, oh, okay, I can take a bit of time, I can pace myself. And going back to what Jacinta was saying, you know, when is the right time for you and when will it work for you is really important, because, you know, it's a big thing and there's no point rushing back into something before you're feeling ready to. We know also that, you know, for about over 50% of people, they do need that flexible return to work plan. And this might be something that's temporary, or this might be something that actually is more of a long-term flexible working plan. Unfortunately, also the stats show that women are much less likely to return to work. And so we want to do everything to get everyone back to work. There needs to be equity in that. And understandably, there's a lot of implications with, you know, delays in returning to work, or actually, you know, looking at that flexible return to work, whether this be financial burdens or even just confidence, like Jacinta was saying, you know, it's when we get out of that routine, it can, you know, take us a little while to build up to getting back to there, but we definitely can. And all the research also shows one of the biggest limiting factors is limited access to supports around how do I return to work? You know, how do I get supports with engaging with my employer? What does a, you know, supported return to work plan look like? So hopefully sessions like this actually starts to give us some resources about how do I access those services, where can I turn to, so you're not feeling like it's all on you to do it yourself. So some of the common issues that we know people might experience that particularly impact on their return to work post a transplant are fatigue. So as Jacinta's already hit on, fatigue is a really significant factor, not just for people who have undergone a transplant, but pretty much anyone that's had a cancer diagnosis or received cancer treatment. And we know that actually about 22% of people that have undergone a transplant report that they're feeling like they can't work at the same speeds or the same pace as they were previously. So that workability is actually reduced. We know that there's significant cognitive changes, so particularly about our ability to hold our focus or our attention or multitask. Multitasking is like brain acrobatics, and it's really hard. And what we know is that actually undergoing particularly chemotherapy, the research is showing that it slows down our brain's processing speed. And so therefore, when we're trying to maintain our focus, or we're trying to remember information, or we're trying to do those brain acrobatics where, you're planning everything out or problem solving, our poor brain is working really, really hard, and it gets tired, like our muscles would if we tried to do a marathon. So we kind of need to be kind to our brain, but work is one of those areas where often we're needing to use our brain quite a lot. We know there can be changes to our appetite and our diet, and this, once again, we're not getting those calories in, we're not giving our body all the nutrients it needs to be able to function as normally, tires out fast. We know that there can be those sort of emotional changes, understandably, related to having a transplant. And also, like you're saying, Jacinta, your confidence can be knocked, understandably. You had not been at work, or, suddenly you're feeling, oh, I can't work as easily as I used to. We know there can be ongoing medical, issues or ongoing appointments that can impact on our, hours at work. Hospitals, we work well, but also we don't really take into consideration always that, hey, you have other things going on outside of your appointments, and no, we need you here now, drop everything else. We know there can be changes in relationships, whether this be your personal ones or your work relationships. How do I fit back into that group? How do I communicate with people? We also know that our goals and our priorities can change as well. Like you're saying, I will talk about this further, but there is that post-traumatic growth where suddenly we reassess where we are in the world, what is important to us, where do we want to have our focus. We can have physical changes. We know that when you're undergoing treatment, particularly a transplant, there's a lot of time in bed, understandably, a lot of time in hospital. And our body is kind of inherently lazy. So if we're not using it, our muscles just get weaker, and they get weak super fast, and they take a long time to build up. So if we're working more physically, understandably we'll get tired. We may find you can't do things as easily as you used to. And then there are also some of those changes related to treatment. So whether this is the graft versus host, if you happen to have that, which can be really uncomfortable, and can impact if you're someone that's a bit more of a physical job, or I've worked with people who've had it and, they've had lesions on their hands, and that's made it hard to do things like typing. Or you can have changes, you might have changes to, say, hearing or vision related to treatment side effects. So lots of things that might be impacting. And I know I'm making it sound very doom and gloom. It isn't. There are lots of things we can do around this. So I would love to say I'm going to address everything. Alas, 20 minutes is not long enough to address hardly any of it, but I thought I'd pick out 3 key areas. So fatigue, because we know fatigue is a big thing. Fatigue, I'm going to give you some resources about where you can go to get more information about fatigue, but just some really, really quick tips and tricks around fatigue and how you can start to think about it in terms of work and study. So the first one is the 4 Ps. So the 4 Ps is a really easy way to start thinking about what can I do? How can I change? How can I sort of manage my energy a bit better? So what we want to think about is, what do we prioritize? What do you want to do? What's meaningful to you? What are those really have to do things that you need to do? And what are things maybe we can deprioritize, or we can look at doing in a different way, or we can get some assistance with? What aspects of your role at work are those things that are still really important and really meaningful to you? And which ones are you maybe happy to let go of a little bit? Like you're saying, Jacinta, having those people check over your spelling just to do a double check. is that something you need to put all your energy into, or is it something you can go, hey, I'll let other people do this? Planning might sound really, really obvious, but actually having a really good schedule or routine is key, because then you know what to expect in your day. You can plan out actually how long are things going to take me realistically, how much energy am I going to use up on those tasks, and not overwhelm yourself. One of the things we hear most with fatigue is that people go into what we call a boom bust cycle, where you're like, okay, I'm going to do everything, and you go gung ho, and then you hit your crash point, and then you just, you need a long time to recover. And then we keep doing that pattern, and it's almost like, one step forward, two steps back. So, we want to plan things out, and then that's where our pacing comes in. So we want to stop before we get to that point where we're starting to feel more fatigued. Now, when we talk about fatigue, we can talk about physical fatigue, obviously, where, I do something physical, I need to sit down, I need to have a rest. But there's also cognitive fatigue. So this is where, once again, like I was saying, the brain actually is working so much harder. And you might find you're already doing this now, that you're starting to get distracted. We're starting to look around. We might start to procrastinate. You're like, oh, that corner up the top of the house is really interesting now. That's when our brain's giving us that red flag going, guys, I'm tired, I need a break. So we want to stop before we get to that point. Much, much easier said than done. But starting to notice at work, okay, well, like I can, if I'm on the computer, I'm doing this task, I can do it for about 20 minutes and I'm not losing my focus. Half an hour, I'm losing my focus. We want to stop at that 20-minute point, do something else. So if you're doing computer work, I'd usually say, your recharging activities are going to be something like going and doing something a bit physical, get a cup of tea, go get some air, something like that, just to give your brain a break. And then also positioning. So particularly with work, good ergonomics, good workplace setup is really, really key. Like Jacinta said, thinking about grading out an increase in activity. So we don't want to just go back gung-ho and feel absolutely shattered and then feel like we're not achieving. You're kind of setting yourself up for failure. So what we want you to be doing is sort of building up both physical and cognitive activity nice and slowly. Do, like Jacinta said, figure out what you think you can realistically do. Take it down a bit more than that, and that's your starting point, and then slowly build it back up. Setting realistic goals, it's really hard to do, but if you be kind to yourself, start lower, do less, and then you can always build up on those. And if you do it all and then you think, oh, I can do more today, great, fabulous, you feel fantastic. But if you get to that point and you finish everything that you set and you're like, actually, I'm done, you're not going to have that sort of overwhelming or overhanging sort of like, oh dear, I didn't achieve this, which is a horrible feeling, because you're achieving heaps by just getting back to the workplace, as the stats will say. The other thing to think about is, what are those tasks you can be doing that recharge you? So often with fatigue, we talk about rest, and rest, sitting down, isn't that thing for everyone. We want to think about recharging more so, because for some people, it might be that what they need to do is go for a walk at lunchtime, or they might need to do a little bit of meditation or some breath work. Or I have one lady that I work with who, she likes to every hour go and do a set of push-ups. Now that for me isn't my idea of recharging, but for her, that's what gets her going. So it's really individualized, but think about what you can use and then use that throughout your working day to give yourself those little energy shots almost. From a cognition perspective, there's fatigue and cognition, there's a lot of crossover here. But think about having that routine and schedule. We do know that also the brain loves routine. The brain finds it calming. The brain actually finds it, really reassuring. They've done functional MRIs to show this, that actually the brain kind of calms down when it knows what's happening. And so if we think about trying to do that within our workday where possible, it's really helpful, because we're not going to get those surprises. We're not going to think, oh God, I now need to scrabble and what do I need to do? Sending our brain into overdrive and working really hard, which then means that actually it's harder for us to perform those cognitive tasks. One thing, I guess, and highlighting amongst that is, when we start to feel stressed or we start to feel worried or anxious or anything like that, just a natural process, the way our brain is designed, it releases stress hormones. And these stress hormones, what they do is they can put us in the fight or flight response. And with that, it means that certain parts of our brain get pretty much more attention than other parts. And the parts that don't get attention are things like our problem solving, our planning, those more complex parts of our brain function. And so it slows down everything we're trying to actually do further. So I know it sounds really easy, me saying, oh, just don't get stressed. But we do know that if we can do some work around reducing our stress around, issues with our thinking or our memory, it can actually help it and speed up the processing speed. Avoiding to-do lists. I don't know if everyone else. I personally used to love a to-do list. Well, I thought I did, but then I just knew it made me more and more stressed because I'd always add to it and I'd never get it done. And I always felt like I was just climbing that hill and never getting to the top. To-do lists aren't fantastic because they just add stress and they set often unrealistic goals for us. Instead, try scheduling specific tasks you want to do in for the day using that realistic goal setting, because then we know we're going to get them done. And then if you've got things you need to do, you can add that to the next day. Plan them out rather than just run that receipt up. Some people I work with get a bit worried about using prompts. They think, oh, I'm making my brain lazy. I'm not going to get it better. Prompts are really helpful because once again, it just gives our brain that sort of a little help about where to find that information. So there's nothing wrong with, using recording key information if you're in a meeting, or having the occasional post-it up where it tells you, I'll remember to do this, or, I'll remember to this meeting, anything like that. They can be really, really helpful. It's not a cheat. It's just a way to help your brain actually remember information and not stress about it. It's kind of like that thing of, when you wake up at 3 o'clock in the morning and there's that thing suddenly you need to remember and you can't get back to sleep because you're trying to remember it all the time. That's kind of what our brain's doing when we're having more difficulty remembering information. It's constantly trying to bring us back to it so we don't forget it. And that's really tiring, and we're putting a lot of effort into doing that. So if we can put it somewhere else and come back to it, it just takes that pressure off our brain straight away. And a diary is really, really helpful for all of this, just to be, whether it's an electronic diary or it's a paper diary, having it somewhere where you've got, what do I need to do? I can just quickly reference that. I don't need to try and remember it. It's not going to make your memory worse. It's going to probably make your brain function easier. And the other really key thing, particularly around work, is trying to make the workspace work for you. So the rise of open plan offices, fabulous. If you're finding that it's harder to focus, they're terrible. You often have people walking around, you'll have distractions, there's lots of noise, it's really hard. So think about where can you set yourself up with the least distractions. So once again, your brain's not being pulled away, it's focused from what you're doing. So, can you be sitting somewhere in a corner so you don't have everyone else walking past? Can you be wearing headphones so you don't have all that external noise coming in? Also give people a bit of a prompt to not come and distract you and ask you questions whilst you're doing this. Good lighting as well, or even just desk setup. So or if you're doing more manual work, how can you have it set up so maybe you don't need to stand the entire time, you can sit for part of it, or you can be having an area that's not so exposed to the elements, so you're not so cold, and then that's sort of tiring you out as well. So there's lots of aspects around your actually office setup that can be really, really important to consider. That just means that you can focus easier, you can work more easily, you're not getting distracted constantly, which makes it really hard to do our jobs. Like I said before as well, we do know for a lot of people that there's so much research out there looking at what they call post-traumatic change post-transplant. And so this isn't saying it's not a negative thing. It's not a negative thing if people don't have this either. But for a lot of people, it's a life-changing event, and you might come out of it going, do you know what was important to me previously? That's not my goal anymore. I want to shift the post. Now I want to focus on this. It's not uncommon that a lot of people I've worked with, they've changed their career path. They've decided, actually, I want to now study this instead, or I want to work in a different field, or I was previously working long, long hours. I want to shift the work-life balance a little bit more. And that's That's a totally normal thing. And so if that's the case for you, I think it's really important to acknowledge it and to go with it. Don't feel that pressure to go back to what you're doing before. Like Jacinta was saying, you're kind of a changed person. You've been through a lot. So, you know, there are so many services, there's so many support services out there that can help you look at where do you go? How do you change things now? And I'll give you some of those support services later on. But I think, you know, don't feel like you just need to go back to what you were doing before. So quick things that we can talk about of how can you prepare yourself for returning to work. So reasonable adjustments. Reasonable adjustments are much more than just changes in hours. So it can be reduced hours, it can be flexible hours, not having to travel within peak hours, but it can also be things like working from home. It can be things like using assistive technology at work. It can be having a set desk that's yours, so you don't need a hot desk and constantly move around. It can be having access to a space where you can go that's quieter or that you can lie down and rest. So there's lots and lots of options in that. Jacinta's kindly touched on some of these things for me, which is good because I've ranted too much already, but communication is key, and having that early communication with your manager or your boss is really important. You are the expert in how you're feeling. You're the expert in what has been, you know, what maybe difficulties you're experiencing. They won't, most likely they haven't been through this. So it's really important that you feel empowered to do this as a collaborative process, but you are the leader in this. So I would say to everyone, when you're going into those meetings, before you go in, think about what was my role? What aspects of it can I still do? What do I think I'm going to be absolutely fine? Don't need any adjustments. And then what do I think might be more challenging? But what would be helpful in that? What can work bring? Because, you know, going there with all those suggestions, it's a bit of a power move. It's fabulous. Workplaces love it. But also it shows that, you know, you're still able to do that role, and there's still aspects of it, and you know, work will work with you around that. But it's really important to go in with some of that prep work. In terms of study, I'd say first most important thing, if you're studying or if you're wanting to get into study, is get yourself registered with your study place's disability service. I know, unfortunately, like often we think of disability services and it can have not the most positive connotations, but what they can do is they are the team that will put in place a supported study plan really early. So these are things like extended time for assignments and exams, or, you know, whether you can study from home instead of going on site. They can make adjustments, they can do reduced course loads. So they are your key people. They can also support you if you do need to withdraw at all. And so actually, a lot of people I've worked with before that were studying have thought, oh no, well, you know, it's too late in the semester, I can't withdraw. For medical reasons, you can withdraw without financial or academic penalty. Even up until exams time, you can still do that. So get in touch with them early. If you do find that you start like a unit of study and then suddenly you're like, actually, I feel I need a little bit more time, you can withdraw pretty much any time up until exams, but you just need to link in with these guys because they're going to be your advocacy team, and they're going to be the ones that help you and make sure you don't have any of those, you know, issues overhanging. I'd also say really early communication with your course lead or your unit lead, if you're happy to, is key because they can help navigate a lot of these things as well. So who else can help? Like Jacinta and Yvonne have already said, your medical team, get in touch with them really early, talk with your nurses. Also, I'd say occupational therapists. I'm always going to say we can, but we can. Physios, if you're finding that, or exercise physiologists, if you're finding you're having changes to, you know, your mobility or your strength, you know, building yourself back up. Psychologists can be really helpful, or counsellors as well, if you just need someone to talk about what you've been through, because it's huge. And also strategies around how to manage some of those, you know, changes in yourself or changes in your confidence. These are some resources that we'll share with you. I've just got some general information, some information around, you know, the Cancer Council's rights around work, but then also around career advice if you're looking at changing your path. So if you're under 25, every state has its own youth cancer service, and they will have an education team in there that can support you. In Victoria, we are lucky, we've got skills and job centres in most universities. So you can actually go on the website that I'm sharing here, and they'll tell you where you can go and get free advice around new career paths and how you get into that, but also Services Australia. And then I've also put some resources here around symptom management, around fatigue and changes in our memory and thinking. But obviously this is an extensive list. And sorry I've gone over time, but that is my spiel done.
Thank you, Pip. That was absolutely fantastic. And we will forgive you, and I'm sure the audience will too, because there was so much wonderful information in your presentation. So look, on behalf of Transplant Talk and Arrow and our audience, would like to thank you both for your wonderful presentations. And I'm going to hand over to Jen, who is going to host our Q&A. Thanks, Jen.
I think you're on mute, Jen.
There we go. Sorry, I had the Q&A panel right over my button that lets me unmute. Yeah, that was wonderful. Thank you so much to both of you, Jacinta and Pippa. I've not had a bone marrow transplant, and I don't work in the bone marrow transplant field other than my role with Arrow, which is a lot of the time behind the desk. So there was so much in there to think about that I had never even considered. Thank you so much for sharing all of that. It was wonderful. Jacinta, I love the idea of a bone marrow transplant party at diagnosis. As you say, everybody reacts differently. I haven't heard that one before. One question that has come up is a carer who's here tonight. The person that she's caring for, his bone marrow transplant, it looks like it's been postponed for quite some time. He's dealing with a lot of fatigue, but is thinking about returning to work in the interim for his mental health. Have you guys got any tips for someone in that kind of situation who is, juggling all of that unknown, the pre-transplant period where you've got so many things jostling through your mind? Jacinta?
Look, I think it's definitely something that if the individual that has the uncertainty over their mind of the bone marrow transplant, for me, it's a personal journey, but it was so important to maintain an identity other than just someone with a very, very serious health diagnosis who may need a transplant in the future. I had 4 years of uncertainty, and I worked constantly throughout that period with adjustments. So I'll let Pippa talk to the practicalities of that. But for me, I just think it's a really important that we look at this as a whole person approach, and your mental health is as important in this battle. And it's hard because carers, I think, are naturally very protective and concerned for their loved ones as well. So both those sets of emotions would be really valid. But you've got to play the long game, and it's what will give you that sense of wholeness for as long as possible, no matter what the challenges you have to face are.
Yvonne, do you have anything to add to that about the practicalities?
Yeah, look, and I really like what Jacinta said there, because it's really understandable for carers feeling quite anxious when their loved one wants to perhaps do something that they're concerned about. And I know in the question there was a comment about the drive home after working as well. And we all know, sometimes you're exhausted at the end of the day. But, I would suggest, again, having a conversation with the healthcare team, just getting some medical reassurance around that. And then, giving it a crack, because there can be so many benefits around that whole feeling of the contribution piece, as well as the kind of the self-esteem and the the self-worth piece as well. Pippa,
Yeah.
have you got any other suggestions?
No, I think I just echo what Yvonne and Jacinta have said. I think particularly when it comes to like mood, energy levels, everything like that, the more independence that we can maintain, and also the more we can engage in things that are meaningful to us, things that make us feel good, things that make us feel like we've achieved something, we do know that actually that's one of the most important things that we can be doing, and actually has the most benefit for people. So, you know, for me, when I'm working with people, generally that's the first part I start. I'm like, what's meaningful to you? What is important to you? That's where we're going to put all of our focus, because actually we're going to get the most reward and we're going to get the best outcomes from doing that. So I fully appreciate it can be really hard when we're supporting someone. We think, oh, I want to support them in every way, and you know, I can take over that. But if it's meaningful to them, we really want to encourage people to, you know, keep at those things, and they can give you other things that aren't so meaningful.
That take over phrase that you just used, Pippa, leads into another question. How do you manage when you're returning to work, colleagues or family members even, that with all the best intentions are trying to cotton wool you a little bit? Any tips there?
I'm laughing because my mother emailed 160 of her closest friends updates throughout my experience. So I'm going to head over to Pippa and Yvonne on that one.
I think, and this is something we do see like really frequently, and a lot of people report this. In my experience, it's hard as it is, it's about finding ways to have some of those frank discussions. And if it's not you, or if you don't feel comfortable, because if there's a, you know, if you've got a huddle of them that are trying to support you in a, you know, in a lovely way, maybe having that one person you allocate that can kind of speak on your behalf. But, you know, setting those really clear boundaries around, actually, these are things that are important to me. These are things I can do. These are things I want to do. And this is why. People want to help. People are lovely, they always want to, but also it is so important that you maintain. So having some of those open discussions, and particularly if it's at work, maybe it's more so, you know, having them with your manager, and your manager can then relay to the team, actually, this is this person's role, and this is what they'll be doing if they, you know, so it's coming from higher up, so it's not just coming from you. Yvonne?
Yeah, look, I think, you know, a theme that's come through during tonight's discussion is communication on lots of different levels. So, you know, communication with your healthcare team, communication with your employer, and with your carer, your family, and your friends. There's always a risk, and, you know, this is something that obviously we see and patients tell us time and time again, is that often they feel disempowered. And just because people, and Jacinta can speak to this better than the rest of us on the panel, but, you know, there's always a risk when people are going through something like a transplant, when they're not particularly well, that they become disempowered, because so many people take over and do many different things for them. Most of those things are absolutely wonderful and really necessary, but it's really important to remember that there's still a person that has choices and decisions to make, and people who want to be part of any decisions that are made, and to really have those conversations with them and support them to then be able to achieve the goals they want to do, and transition back out of being a transplant recipient and being unwell back into whatever level of or whatever definition of normality they want to achieve following their transplant. I think that's super important. So, you know, communication's bi-directional. It's, you know, it's speaking, but it's also listening. So really listening to the transplant recipient in your life.
Jacinta, do you have anything to add there?
You know, don't be afraid of, carers and transplant recipients will go through so many change cycles, because it is a long process, and you might find yourself having to adapt 2, 3, 4 times. And, you know, don't be afraid of that. You know, if anything, there's an opportunity there to deepen your connections with the people you love outside the space of carer, patient carer. And I think that agency point that Yvonne has made is really important. And I felt like, you know, yes, part of my transplant process was about having a transplant, but the other 70% was like complex organizational management of my family. So, there's lots of tools to help you do that as well. If you're the patient and you need to sort of gently set some supportive boundaries around where your agency lies as well. And that's a conversation that you can have. We did it with concentric circles. My partner at the time and I drew like 4 circles, and then we had like the inner circle, the next circle, the next circle, and the next circle, and then delegated out accordingly. But everyone's different, and you'll navigate it in a way that works for you and your loved ones, and that's the most important thing, is that everyone feels empowered.
Thank you. Well, I noticed that we're coming up to time, so once again, thank you very much to Yvonne, Jacinta and Pippa. It's been a wonderful webinar tonight. And thank you to everyone who's come along to Transplant Talk Live. Really appreciate you giving up your Tuesday night. Hopefully you found that webinar and those presentations really useful. Just a couple of things before we wrap up. Once again, I want to thank Tour de Cure for helping to make these webinars possible. And a little bit about who we are at Arrow. So we're Arrow, the Bone Marrow Transplant Foundation, and we are here to support bone marrow transplant patients and the people who care for them. And that includes their families and their carers, but also health professionals and medical researchers. So we have a patient support program, and we also have scholarships for nurses and healthcare professionals, and we have scholarships for PhD researchers whose work is looking at improving outcomes for bone marrow transplant patients. So you can find out all about what we do on our website. If you haven't been there, it's arrow.org.au. So it's www.arrow.org.au. One other thing before we go, there is a wonderful person that we've met on Instagram. Her name is Sarah. She is a lymphoma patient. She also is an HR expert, and she has a service going at the moment where people who have had cancer, who are looking at getting back into work, who need someone to put past their eyes over their CV, she will do that free of charge. Now, she can't be inundated. So if that is something that any of you here tonight would be interested in, please drop us an email and I can put you in touch with Sarah. She's very willing to offer that to people who legitimately need her help. And also, before we go, there will be a questionnaire that pops up at the end of this webinar. We would love you to take a minute to fill that out. It's only about 4 or 5 questions. It won't take you long. One thing to note, though, it is anonymous. So please give us your really open and honest feedback. That's really helpful. But it does mean that if you ask us a question there, we won't be able to reply because we won't know who it is who has left that question. If you do have any questions for us, please drop us an email. If you hit reply on any of the emails that you got about tonight's webinar, that will come through to us. Or you can send it to info@arrow.org.au. So any questions at all. If you feel like you need some extra support, if tonight's conversation has raised any issues for you and you don't know where to turn, by all means, contact us about that and we'll help you find the people who can give you the best advice there as well. So once again, thank you very much to everyone. Thank you for spending Tuesday night with us, and we'll see you again soon.